I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We are going to talk about your digestive system. And patients come to us all the time, and many patients think that we can fix everything. And many times we can. But patients come in and they assume that if they come see Dr. Joe and his team of doctors, that there's very few things that we don't have an answer for. And the answer is yes, that's true. However, there's sometimes you need to say, I need some outside help. And we do this sometimes with patients, and usually patients listen to us, but I've had patients argue with me in the past. They'll say, I'm not going to do that. No, Dr. Joe, your team has to fix it for me. And I'm like, no, this is a little out of our wheelhouse. So we have a team of doctors that we refer to. In fact, we're setting up a referral network with the doctors that we refer to. It's going to be on the website pretty soon. And this way you can look up your own doctors instead of sending it to me and say, Dr. Joe, who do you use for water filters? Who do you use for gynecologists? Well, not me, use gynecologist. Who do you use for dentistry? Who's your eye doctor? I'm going to put it all on the website very shortly. So hang on there. I got a meeting today to try to get that rocking. So there are some things that many times are fixable, but sometimes it's time to take an emergency approach to this. This is get to the emergency room right away. One of them could be stomach cramps. Now, very common stomach cramps can be caused by Crohn's disease, irritable bowel syndrome, colitis, and so it may not be an emergency right away. But there's usually an inflammatory condition that happens in the digestive system that causes the cramping. Your cramps flare up when a disease is active, like Crohn's and colitis, irritable bowel syndrome, things like that. So you don't necessarily have to run to the emergency room right away. I want you to consider getting that under control. Now, a couple of tricks that you can do for stomach cramps to hopefully get them under control. If you can't get them under control, get to the emergency room. Number one, I want you to cut out all wheat, not meat, well, meat too, but wheat and dairy. Wheat and dairy, if you eat them, many times cause inflammation of the bowels. Some people more than others. So cut out wheat and cut out dairy if you have bad stomach cramps. Do it for 2 weeks. See how you do. Now, when I say 2 weeks, that doesn't mean a little bit of wheat. That doesn't mean pizza on Saturday. That doesn't mean I had to go to Bobby's birthday party and I had cake. No wheat, no dairy, not a drop, not a fleck, not an ounce, not a speck, not a gram. 2 weeks. At the end of 2 weeks, eat wheat and dairy again, maybe some pizza, and see how you feel. And if I'm right, I was right. If I'm wrong, so what? I was wrong. You didn't eat wheat and dairy for 2 weeks. So what? Nothing ventured, nothing gained. But many times that solves the stomach cramps. If you're having cramps, little trick you can do is take a hot towel and lay it across your abdomen. Now you can use a hot pack. Don't use an electric hot pack. Electric heating pads create an electrical field that is not good for your body. So you can heat it up and turn it off and put it on you. Same thing with electric blankets, folks. Electric, mattress warmers, please don't use them. That's a whole nother show on electromagnetic frequencies. But you can take a hot towel. You can wet a hand towel if you still have a microwave, which you shouldn't have anyway. Put it in a microwave, heat it up, make sure it's wet. Don't put dry in there. You'll burn the house down. And lay it across your abdomen. Don't burn yourself, of course. Great trick for getting kids to go to sleep. If you can get a warm, like a water bottle, a hot water bottle, because it's not wet, lay it across their abdomen while you read them a story. Beep, 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 beep. They'll be sleeping in no time. It works great. Because what happens is it kicks in the enteric nervous system, which is a parasympathetic part of the body. Parasympathetic nerves slow you down. Sympathetic nerves speed you up. S&S, sympathetic speed you up. So parasympathetic nerves, if you can activate the parasympathetic nervous system, calms you down. Digestion is a parasympathetic function. Romance is a parasympathetic function. Sleep, of course, is a parasympathetic function. So kicking in those parasympathetics is what you want to do. Massaging somebody's shoulder. You're massaging the trapezius muscle, which is innervated by the spinal accessory nerve, which is a parasympathetic nerve. So I could rub your hand. It might feel nice. I could rub your arm. It might feel nice. But rubbing the shoulders just seems to so relax you because you're activating the parasympathetic nervous system. And with digestive issues, parasympathetic nervous system is the key. So that's why a warm towel across your abdomen may help you go to sleep too. It's kind of a neat little trick. Give you all my secrets here. If the belly gets swollen, it gets harder and bigger than it normally should. That means sometimes food and liquid can't pass through, and there might be tissue growth. There might be a tumor growing in there. There might be an infection. It might be hernia. You might have cramps, no appetite, trouble going to the bathroom, even trouble passing gas. The body, nothing's moving along. You probably want to see a doctor right away. If you lay on your back and your belly's all bloated and you push on fluid and it makes a wave like a waterbed, if you're old enough to remember what a waterbed is, if you see that, that could be ascites. That can be fluid in the abdomen. You want to get to a medical doctor right away. It's an interesting show. I'm telling you not to come see us for these, right? These are things you want to get checked out right away. But if your stomach is bloated and really hard, it could be swollen liver. It could be an impacted colon. These are things you want to get checked on right away. And if you have a fever to go with it, then it's an emergency. If you're throwing up blood, this is not a chiropractic case, folks. This is a medical case. It could mean you have an ulcer. The lining of your stomach or the upper intestine can get eaten away by something called H. pylori. H. pylori is a bacteria that lives in everybody's gut. Now, if you have enough stomach acid, this is where the irony of this, the twist of this story comes in. If you have high enough stomach acid, it keeps the bacteria in check. It kills it off. If your stomach acid gets too low, what can happen is the bacteria starts to reproduce. And if the bacteria reproduces, it can eat a hole in your stomach. And so trying to neutralize stomach acid when you have an ulcer many times is counterintuitive, but counterproductive. Because you want to increase the stomach acid to kill off the bacteria so the ulcer can heal. So we can do that with something simple like raw organic apple cider vinegar, doing maybe a tablespoon or two of that. Dr. Joe's Digestive Enzymes. I've had patients come back and tell me they got real good results with ulcers by taking Dr. Joe's Digestive Enzymes. So increasing the stomach acid is going to be the key. If you have acid reflux, heartburn, burping, gas, bloating, many cases, my team of doctors can pull the stomach down away from the diaphragm, solve the problem. We were at a restaurant last night. There was three neurosurgeons, myself, another chiropractor, and a sales rep from a medical clinic. And the waitress comes over, and somehow, my friend Steve, one of the doctors, was saying, "Oh, you know who this is? This is Dr. Joe. He's famous. You don't know who Dr. Joe is." And so he likes to brag about hanging out. And so anyway, she started talking about her digestive system. Young girl. And she's talking about her digestive system. And sometimes her stomach hurts, and the only thing that helps is eating packets of sugar. And so we went off on this big thing. And it was funny because the neurosurgeons were sitting there going, "Wow, I never thought of it like that before." And so a case like that probably would be a good chiropractic case. Pull the stomach away from the diaphragm. I told her eat some celery, spinach, or figs to neutralize some of the acid and see if we can get that fixed up. But if you're throwing up blood, back to where I was before, you need to get to a medical doctor right away. Because if you tear the esophagus, you can die. And what happens is many times alcoholics don't die of alcoholism, they bleed to death. Because their liver gets so clogged up that there's back pressure. We talked about that in the show earlier on blood pressure. There's back pressure on the veins in the esophagus, and the veins, the arteries especially, can burst. And if the arteries burst, you basically bleed into your stomach and you die. So that could be a reason why alcoholics die, not from the liver issue, but from the bleeding issue. So if you have blood and vomit and you're throwing up a lot, that's something you don't want to play around a lot. If you have pain around your belly button area, push on your belly button and it hurts. That can be a sign of a urinary tract infection, especially with kids. It might feel like a dull pain or some pressure. It usually comes with other symptoms. You might have a fever. You might have burning on urination. Pelvic inflammatory disease is seen in some of these problems, and urinary tract infections can cause pain during romance. Now, there is a condition. It's called honeymoon cystitis. And honeymoon cystitis, it's a tongue-in-cheek analogy, is if someone's having a lot of romance, perhaps they're not used to that much, it can irritate the urethra and cause a urinary tract infection. So it's called honeymoon cystitis. But if you have that and you start bleeding, that might be something that's a medical emergency. Now, I've had countless patients with urinary tract infections where we adjust the low back and it solves the problem. Because the nerves in the low back control everything from the waist down. So if you have a pinched nerve in the low back, you might have back pain, leg pain, hip pain, knee pain, ankle pain. But it's the same nerve that controls your colon, sex organs, and bladder. So if you have a pinched nerve in the low back, it might cause things like gas, bloating, diarrhea, constipation, urinary issues, romantic issues, women, menstrual cycle issues, prostate issues, erectile issues. Anything from the waist down is controlled by those low back nerves. And men especially have a tendency to injure their low back at certain times in their lives. Maybe they played sports, they lifted too much, they thought they were being tough, got street fights. I cannot confirm or deny that that might be myself. But things like that could have irritated the nerves in the low back. Even I have a fracture in my low back. So I played football and hockey and street fights and car accidents and who knows what caused it. But that fracture, now as I'm getting older, has to be stabilized. I just did a round of PRP injections into my low back to help stimulate new growth around that, stimulate the disc to try to stabilize my low back. Now, if you don't know what PRP is, it's one of the services we do here in the office. We can take your blood, spin it down, and take out something called the platelets. The platelets are the growth factors. And we can inject the platelets back into the area, whether it's the knee, the shoulder. Knees are very popular for PRP. Anywhere where there's degeneration, the spine, which is what I had with me, and I inject it back into that area to stimulate new growth. Now, it's not going to be like it was when I was a kid. I know that. But as I'm getting older, the platelets attract stem cells, and stem cells help generate new growth. So very, very popular service that we offer here at the office, and we probably do several a week. We have a medical doctor that is here once a week, and we probably do a couple a week to help folks with knee arthritis, shoulder arthritis, carpal tunnel syndrome. It can be used for erectile dysfunction because when you inject it into an area, it stimulates new growth, new blood vessels. Women, if they have trouble in romance or they cough and sneeze, they pee a lot, maybe they've had a bunch of kids and things in the lower part of the body isn't working like it used to, you might be a candidate for PRP as well. We can take your own cells and inject it back into the body to stimulate new growth. So it's really cool. And with erectile dysfunction, just a patient the other day asked me about, little blue pills. And I said, well, they work, but there's side effects. With this, there really isn't a whole lot of side effects. If it works, and it's your own cells. So I like to get to the cause of the problem, which is the vascularity issue, and try to generate new blood vessels as opposed to just dumping a pill in there to try to get a quick rush of blood. And very popular with the men, of course, and women. So we can do that. It's on the website, drjoe.com. You can just look up PRP. We have a lot of good information there for that. But with urinary tract infections, we can open up the nerve supply in the low back. That's where I was going with this. Now, the difference between our clinic and other clinics that might do things like regenerative medicine is that we include the chiropractic, putting the bones back in place, opening up the nerve supply. We include the nutrition evaluation so the body has the raw materials to regenerate. Even if I had the best PRP or exosomes or whatever it is to stimulate new growth and I don't have the raw materials to grow new cells, you're not going to get the best bang for your buck. So that's why our office, I feel, is outstanding in the field of regenerative medicine because we incorporate everything from different angles. And it's very exciting. And people come from all over the world to see us, which is kind of cool. And if you're new to the show, by the way, folks, I'm Dr. Joe Esposito. We have offices in Marietta, Duluth, Stockbridge, and West Cobb in the Atlanta area. I know this show goes all over the world. So if you want to come see us, you're more than welcome to. We've had people fly in from all four corners of the world. I don't know where those four corners are, but they've come from there. And we try to get to the cause of your problem. With digestive issues, too, we always want to make sure you have the right raw materials. So supplement-wise, when it comes to digestive issues, of course, the minimum supplements I feel everybody should be taking are Dr. Joe's Super Greens and Dr. Joe's Essential Source. And they're on the website, drjoe.com. We'll ship them to you the day you order. Joe usually ships it out that day or the next day. Or you can pick them up. We have, again, pick up in our offices, Marietta, Duluth, Stockbridge, and West Cobb. We'd like to meet you. Say hi. So you can save shipping costs, too, and then Joe doesn't have to package them for you and saves him some work, too. So I would also recommend for digestion Dr. Joe's probiotics because over time, we're always killing off the good bacteria in our colon. It could be stress. It could be a bad diet. It could be chlorine from water. It could be fluoride from your toothpaste. So these are things that act as antibiotics and kill off good bacteria. So I take a probiotic every day. Essential Source has probiotics in it. Super Greens has prebiotics in it, which feed the bacteria so they can make more baby bacterias. So digestive health, I would say Super Greens, Essential Source, probiotics, and glutathione. Glutathione helps the liver function more efficiently. And I'm a big fan of that because the liver is kind of important. So I take glutathione every day as well. So, and if you have an inflamed bowel, you might want to consider turmeric. All of those are on the website, drjoe.com. We'll ship them to you. You come pick them up, whatever works best for you. We want to get you to supplements any way we can. So we're talking today about digestive issues. We did cover the nerves in the low back. So sometimes you have pain in your low back. So if you have back pain, leg pain, hip pain, chances are you have a pinched nerve causing that. But those same nerves control the digestive system. So you might want to get that checked as well. And we can do that in our offices. So if you have pain, if you have neck pain, back pain, shoulder pain, headaches, sciatica, numbness, carpal tunnel syndrome, just come see us. Let us see if this is a case we think we can help. We never guarantee anything. But my doctors are so well trained. They're my doctors. They're my personal doctors. So if I trust them with me and my family and friends, I'm going to certainly trust them with you. And maybe you're a chiropractic candidate. Maybe you're not. And that's what we're talking about today. Sometimes you're not a chiropractic candidate if you have these symptoms. And let's see if you are. And if you are, great. If you're not, let's get you checked out and get you to the best care possible as quickly as possible. You can't afford not to get healthy, folks. Nothing's more expensive than being sick. And some of you have health insurance, and we accept insurances, and we file insurances, most of them. Medicare, Peach State now, I think we're taking now. Active Healthcare, there's a bunch of new ones we just added to our list, by the way, too. So if you came to us at one time and we didn't accept your insurance, you might want to try again. And by the way, if you are a doctor, we're looking for a nurse practitioner and a chiropractor to join us, or a physician's assistant. So if you're a chiropractor, you're looking for a job, or a nurse practitioner, want to work with us, start a career, build a career, let us know. Send me your resume through the website, drjoe.com. Love to talk to you about that too. But again, if you want to make an appointment to come see us, just go to the website and book it. There's little maps of all the offices. Click on the map. You can book it right online, or you can call us. We're more than happy to answer any questions you have. It's a very easy process being a patient with us. And again, I think we have some of the best doctors in the world because they're my doctors and I've trained them. And it's sad. We've had a lot of doctors come through this office. I've been in the same place, the Marietta office, for 37 years. And we've had a lot of doctors come and go. They don't make it. And I'm a slave driver when it comes to doing things right. I want to make sure my patients are getting the best care. I want to get you treated the same way I get treated. So we've had a lot of doctors come and go. They just don't cut it. So the ones that make it are usually, I consider, the best in the world. So anyway, drjoe.com, you can book an appointment. If you go to the bathroom when you have bowel function and you're bleeding, it could be several things. It could be a hemorrhoid. It could be that your toilet paper was too rough and you cut yourself. But if you see blood, that can be a tear in the rectum. Now, there's two types of blood. There's regular blood that you can see red, and there's also something called occult blood. And occult blood looks like dried blood, like scabs. If that's the case, it could be bleeding in the upper part of your digestive system. And that's something you want to get to a medical doctor for, too. Now, if you have issues with toilet paper, I want you to consider getting a bidet. I am a huge fan of bidets. You can get one, I think it's at Home Depot, with like $250. Now, you have to have a plug in your, if you want this one specifically, you have to have a plug in your bathroom because it has a heated toilet seat. And it heats the water. And it has a blow dryer for you. It's amazing. Talk about being pampered, but it's actually a much more sanitary approach. The analogy a friend of mine uses, my friend Levino, who loves bidets too. He says, if you had chocolate and I wiped it on your hand, you might wipe it off with a rag, but it's still going to be sticky and something's going to be there. He says, same thing with your bottom. And that's why the bidet is amazing. And it pays for itself very quickly because you don't buy toilet paper. So it's just incredible. There are lesser versions for like $30, and some of them have really hard pressure, so be careful if you use them. But you have heated ones, you have non-heated ones. The non-heated ones don't need a plug-in. The heated ones do. But I'm a huge fan of bidets, and you can get them for any toilet. You can just attach it to your toilet seat. Couldn't make it any easier for you. And much healthier, much more sanitary than anything we're doing right now. Most of the world knows about bidets. For some reason, we here in the States don't know about them. But I'm a big fan. I'm going to give bidets 2 thumbs up on that one. No pun intended. If you have pain in your stomach, we're talking about things, digestive issues that might be serious. If you have pain in your upper stomach, in the left side, it's usually the stomach. Now, a lot of patients over the years have had their gallbladder removed. And they've had the gallbladder removed, and they say that's why you're having the acid reflux and the heartburn and the indigestion and the pain. And then they come to me a couple of months later and say, it didn't do a darn thing, Dr. Joe. I just had one the other day, young girl, 16 years old, gorgeous young girl, and she had her gallbladder removed, and it didn't do a darn thing. Now, I'm not a surgeon. I didn't see her MRIs or CAT scans or ultrasounds, whatever he did on her gallbladder, so I don't know if she needed it removed or not. But I do know that once we fixed her spine, the nerve supply to the stomach, and we fixed her stomach, all the pain went away. So I like to try a conservative approach first when it comes to healthcare and then build up if we have to. Pain on the right side of the abdomen could be a gallbladder issue, could be a gallbladder attack. Pain in the lower right side of the abdomen could be the appendix. And I've had people come in with appendix like screaming in pain. And if it bursts, that's a pretty serious issue. So if you have really severe lower right abdominal pain, doubled over in pain, crying, and all of a sudden it just stops, get to the emergency room. Chances are your appendix burst. Fecal matter can now leak into the abdomen, and that can cause a very serious issue. You can get an infection from that. So if all of a sudden it just stops instantly, that's a bad sign. If it goes away slowly, that can be a good sign. So upper right, gallbladder, lower right, appendix, upper right, stomach. Now, again, the stomach lays on top of the pancreas, so the pancreas could be inflamed, and that could be an issue as well. So that's why, again, we try chiropractic, we try adjusting the stomach, we try diet. If it doesn't work, we do what I call escalation of care. Let's go get an ultrasound. Let's get an MRI. Let's get a gastroenterologist to look at this. If it's a pelvic issue, let's get a urinary doctor, a OBGYN, or maybe a urologist take a look at this. And let's find out what's going on in there. Because ignoring your health, there's an old saying, if you ignore your health, it'll go away. Well, your health will go away. You'll lose your health. So don't be stupid. If you have an issue, you want to come see us, we'd love to be your doctors. Hopefully we can fix you. Almost always we can help the patient. If we can't, we have a team of doctors we can refer to. And again, soon we'll have a referral network on our website. We're working on that. One of the issues, too, you always feel full. Anybody feel that way? They just feel bloated all the time? That oftentimes is the stomach pushed up against the diaphragm. Now, it could be an infection, could be an ulcer, could be other things as well, but let's start out slow. And there's something called gastroesophageal reflux disease. It's not really a disease, it's a condition, where the stomach pushes up against the diaphragm. If that acid comes up into the esophagus for too long, it can eat away at the esophagus, and you could actually bleed or develop cancer in the esophagus. It was just the other day I was talking to a doctor. The number one up-and-coming cancer right now is esophageal cancer. I was one of the doctors I knew. That's right, because he had a hiatal hernia surgery and it didn't work. And he said, "What else can you do?" And I explained you could pull the stomach away from the diaphragm in some cases, and I explained it to him. And how I did, he went, again, what doctors always say to me, "I never thought of it like that before. That's brilliant." He said, "Can you take a look at me?" I said, "Sure, I'd love to." So he set up an appointment. I'm going to see him in a couple of days. So sometimes we need to physically fix problems. Sometimes it's chemical. Sometimes it's a pinched nerve. Sometimes it's a medical emergency. If your stools come out black like tar, that's a serious issue. Get that taken care of. If you have a pulsating pain in your abdomen, every time your heart beats, boom, 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 that could be something called a dissecting aortic aneurysm. Your aorta, your blood vessel, splits off into what's called the common iliacs, but the aorta, if it gets clogged up with cholesterol, the aorta can stretch out and eventually can burst. And we see this almost every day where the aorta is clogged. If it's 5.5 millimeters, 5.5 centimeters, 55 millimeters, I've seen about 5 of them in my career. I say, you need to go to the emergency room now. Oh, no, I got an appointment with my doctor 6 months from now. No, now. I cannot let you ethically leave this office unless you go to the emergency room. Because at 55 millimeters, it can burst. And if it bursts, you die instantly. There's not a lot of hope if the aorta dissects. So if you have a pounding pain in the stomach like that, it's something you might want to get checked on right away. You don't want to jerk around. So once again, my team of doctors are really good, but we can't fix everything. So if you'd like to come see us, and let's see if you are a candidate for our treatment, go to our website, drjoe.com. You can book the appointment right online. You can call us. The phone numbers are all over the website. If you have any questions, send them to me through the website, drjoe.com. I need you to follow us on social media. Folks, I love giving you these lectures and these shows and these podcasts, but I need you to do me a favor. Go to social media, Instagram, Facebook, YouTube, and Twitter, at Dr. Joe Esposito. Just do me that as a favor. I appreciate that. I really do. Again, if you're a chiropractor or nurse practitioner looking for a job, we'd love to consider talking to you. We are expanding. We'd like to get some more help in here. And the first visit right now is $249. It's usually about $500. And if you're a podcast junkie, go to your podcast service and type in Dr. Joe for the health of it. Dr. Joe for the health of it. That's the title of my first book. And yes. And we have hundreds of hours of podcasts there. And on the website, drjoe.com, we have about 2,000 hours of podcasts as well. Folks, I'm Dr. Joe Esposito. You need any information, drjoe.com. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.